Hello, my name is Tatum Conklin. Today I will be discussing time management for new grad nurses, highlighting how effective strategies and well-structured transition programs can enhance both nurse performance and patient outcomes. I will also share insights about the time management competency game I had the opportunity to help my preceptor facilitate, which will be discussed at the conclusion of this presentation. Introduction. New graduate nurses often enter practice feeling overwhelmed due to the fast-paced clinical environment and the expectations placed on them. They are responsible for managing multiple patients, administering medications, documenting care, and communicating with the healthcare team, all while still learning. Time management becomes a critical skill during this transition because without it, nurses can quickly feel disorganized and stressed. This not only affects their confidence, but also impacts patient safety. Developing strong time management skills early helps new nurses become more efficient, reduces anxiety, and allows them to provide better, more organized care. Topic importance. Time management is not just about being efficient, it directly affects patient outcomes. When nurses are unable to prioritize tasks effectively, important interventions may be delayed or missed altogether. Additionally, poor time management contributes significantly to nurse burnout. New nurses who feel constantly behind or overwhelmed are more likely to leave the profession early. From an organizational standpoint, this increases turnover rates and staffing challenges. Therefore, improving time management is not only beneficial for the nurse, but also for the entire healthcare system. Intended population. This topic focuses on new grad nurses, particularly those participating in nurse residency or transition programs designed to support their entry into professional practice. Literature overview. The research consistently shows that time management is a learned and developed skill rather than something nurses automatically possess. Studies highlight that new nurses often lack confidence in prioritizing care, especially when faced with competing demands. However, with structured education, mentorship, and repetition, these skills improve significantly. Programs that focus on time management training have been shown to increase efficiency, reduce stress, and improve overall job satisfaction among new nurses. Common challenges. One of the biggest challenges new nurses face is task overload. They are often expected to manage multiple responsibilities simultaneously, often without fully developing prioritization skills. Interruptions are another major barrier. Nurses are frequently interrupted by alarms, patient needs, and communication from other staff, which can disrupt workflow. Documentation also takes a significant amount of time, especially for new nurses who are still learning electronic health record systems. These challenges can lead to feelings of being constantly behind, which increases stress and decreases efficiency. Evidence-based strategies. There are several evidence-based strategies that help improve time management. One key strategy is using prioritization frameworks such as ABC's airway breathing circulation or Maslow's hierarchy of needs. These frameworks help nurses determine which patients or tasks require immediate attention. Delegation is another important skill. New nurses often hesitate to delegate, but appropriate delegation allows them to focus on more critical tasks. Clustering care. Grouping tasks together when entering a patient's room also reduces unnecessary trips and saves time. Lastly, using checklists help to ensure that no tasks are forgotten and improves overall organization. Role of education and training. Education plays a crucial role in developing time management skills. Structured modules and training programs provide nurses with tools and strategies that they can apply in practice. Simulation is essentially effective because it allows nurses to practice managing time in realistic scenarios without the risk of harming patients. Mentorship is equally important. Experienced nurses can guide new graduates, helping them learn how to prioritize tasks and manage their workload more efficiently. Nurse residency programs. Nurse residency programs are designed to support new graduates during their transition into practice. These programs provide structured learning experiences, mentorship, and ongoing education, all of which contribute to improved time management skills. Research shows that nurses who participate in residency programs feel more confident, are better prepared to handle their workload, and are more likely to stay in their position. PTAP accreditation. The Practice Transition Accreditation Program, or PTAP, ensures that nurse residency programs meet established national standards. This accreditation helps ensure consistency and quality in how new nurses are trained and supported. By following evidence-based guidelines, PTAP-accredited programs improve outcomes for both nurses and patients, particularly in areas such as time management, clinical competence, and confidence. Significance to nursing leadership. From a leadership perspective, investing in time management training has significant benefits. Improved time management leads to more efficient workflows, which enhances productivity and reduces delays in patient care. It also contributes to higher job satisfaction among nurses, which reduces turnover and the cost associated with recruiting new staff and training them. Ultimately, strong leadership support in this area leads to better patient outcomes and a more stable workforce. Application to practice. To apply these concepts in practice, healthcare organizations should implement structured orientation and residency programs that include time management training. Providing access to mentors and experienced nurses can help reinforce these skills in real-world settings. Additionally, encouraging ongoing education ensures that nurses continue to refine their time management abilities throughout their careers. Time management session timeline. This brings me to the time management session I was able to attend and help assist with. We started the afternoon by hearing from Shelley McMaster, the Administrative Director of Clinical Integration and Patient Flow, followed by an introduction from Michael Jones, who is the Nurse Manager of 7 West, and group leaders. After these introductions, everyone broke into groups with their nurse leader from their floor or department. They were instructed on how to play the game by the leaders, and after finishing the game, they had a debrief session to discuss what they had learned, what worked well, and what could have gone better. Rules. The rules of the game are as follows. Each player rolled a die, and the highest roller was the first player to start. When it was their turn, they would roll the dice, then move their pawn that many spaces forward. Each task listed on the game board cost time. For example, to review policy, it costs 10 minutes of the nurse's time, which is equivalent to 1 chip. If the player ran out of time, they can earn time back by answering a question on the time saver card. The questions on the time saver cards are relevant to their department. Answering the question counts as the player's turn. If the player cannot answer the time saver question, they can ask for help from their team. The game continues until each player crosses the finish line. The player that finishes with the highest amount of time at the end wins. In conclusion, time management is a foundational skill for new graduate nurses. Without it, nurses are at greater risk for stress, burnout, and errors in patient care. However, with proper education, mentorship, and organizational support, these skills can be developed and strengthened. Nursing leadership plays a critical role in ensuring that new nurses have the resources they need to succeed. By investing in time management training, healthcare organizations can improve both nurse satisfaction and patient outcomes. Here are my references. Thank you.